Hey, it's Lane. I'm going to be doing the IV insertion video. So first thing that I would do would be to check my chart and check my order, make sure that I'm have the right patient and that I'm doing the right thing that the order asks. And then I'm going to gather up all my supplies. So I've got all my supplies gathered here. All right, and then I am going to wash my hands. Knock, knock, knock. Hi, Mrs. Johnson. My name is Lane. I'm going to be your nurse today. I'm just going to check your name band here, okay? So could you just tell me your name and your date of birth? And this is Sally Johnson, 5/20 of 1970. Okay, so I've got the right patient. So I'm just going to provide for privacy here. Okay. All right. So, Mrs. Johnson, I understand that you are going to be getting an IV today started so that we can get any saline fluids that the doctor has ordered ready for you. And then also you've got some IV meds that we're going to be giving you later. So I'm going to get that IV started for you today in your arm. I'll start by putting a needle into your arm to get that catheter in, and then making sure that's nice and secure, and then we'll take that needle out, okay, and it'll be nice and comfortable for you, okay? All right, so do you understand that, and do you have any questions? And she does understand, and she doesn't have any questions. Okay, so all right, so I'm just going to gather up some supplies really quick and get this all set, and then I'll get started, okay? Okay. So I've got all of my supplies here. So the first thing that I'm gonna do is just quick wash my hands again before I touch everything. And then I'm going to grab my saline flush, okay? And then pop this extension out of the bag, and just being really careful not to touch anything with my hands while I'm getting this all prepared. Okay, so just gonna hook this up. And before I would do that, if this was a real saline flush, I would make sure that I popped any of the air that was in, pop that air out, and then make sure that it was all primed and ready to go. Okay, all right, so I've got this hooked up, and I'm just going to put a couple milliliters of saline through this line so that there's no air in it, and I'm gonna squeeze that out. And I see that there's a little bit of saline that came out, so that's good. So I know that this is primed and ready to go. And then I'm also just going to loosen this cap to make sure that it's loose and ready to go for me when I am ready to connect this to the IV for the patient, okay? Okay, so I'm gonna set that back down. All right, I'm gonna make sure that my IV needle is ready to go. I'm just gonna make sure that cap is loosened up and ready to go. It's a 20 gauge. So I gotta make sure that I'm looked at the order and make sure that that's the correct gauge that was ordered. So that was the 20 gauge. And then I've got my clear tape dressing. So I've got that loosened up and ready to go. I've got a gauze sponge in case I need it. Got some gloves, and I've got my tourniquet and my alcohol. Okay, so I'm just gonna get a couple pieces of tape ready here too. So I would put this right here so that they're ready to go, just to make it a little bit easier for when I need to tape some things down. Can you see?
Yeah.
Okay. Okay. All right. So I am just going to come back over here. All right. So Mrs. Johnson, I'm gonna just take a look at your arm. Do you have any allergies to any iodine or anything like that? I see that in your chart you didn't have any allergies to iodine, but I just wanted to make sure that you didn't have anything that wasn't in the chart. She said that she doesn't have any allergies to iodine. I've also checked in your chart to make sure, can you see me, Casey?
Yeah.
Thank you. Okay. I've also checked in your chart to make sure that you haven't had any lymph node surgeries or a mastectomy, so that I can make sure I'm picking the correct arm for the IV. So we're gonna put this IV into your right arm. It's your non-dominant arm, and that one is good to go. All right, so I'm just gonna take a look at your arm. I wanna make sure that I'm looking for nice straight veins, nothing too close to any of the joints of your forearm. And it looks like I don't see anything here. I can see your vein pretty good right there, so this one looks pretty good. Okay, so I am going to wash my hands up and then put some gloves on. All right, you get a drape underneath your arm. All right, so this tourniquet fell on the floor, but if I actually fell on the floor, I would just grab a different tourniquet. All right, get this alcohol. I'm just gonna bring these supplies over here just to make it a little bit easier to grab all of this stuff. Okay, all right, so I'm going to wash up this area right here. So I'm gonna grab my alcohol pad. And I'm going to start in the center here and just rub for 15 seconds, circular motion, starting in the middle and all the way out. So 15 seconds. All right, let's tourniquet on. Kind of snug, but not too snug. Just a gentle tourniquet. All right, and I want to make sure that I only have this on for up to 2 minutes, so I want to make sure I keep an eye on that. Also, if there were any other issues trying to find a vein, I could use a heat compress or kind of just like gently tap for a vein. Okay. And now that I've done that and made sure that I did that before I used my alcohol wipe, I would have to wipe again if I touched it because I would want to make sure that I didn't touch it after the alcohol. Okay, so I'm going to hold nice and tight right here, kind of keep the skin taut with my non-dominant hand. Got this right here. Gently go in 15 to 30 degree angle. All right, and I see a flash here. So I'm just gonna get that straight down to the skin. All right, and I'm gonna hold tight right here and push the catheter all the way down to the skin. And then I would lock this up normally, but since we can't, I'm just going to set that back in. Would have engaged the safety. All right, make sure that I get the tourniquet off. All right, and then holding as still as possible, I grab this and pop that off and not touch. Not to touch it. Touch it. Keep that nice and stiff, okay? All right, and I'm just gonna put a little bit of saline through here, okay? So you let me know if can you feel any pressure or any pain, Mrs. Johnson, with that? And she says that she doesn't, so good. Okay, so you can get this. Just gonna get this taped down right here. All right, so I have that taped. And then put my clear dressing on. And then just making sure that I can cover up that whole pink part. And then rip these off. All right. Then I could tape anything else or anywhere else that I needed to tape on her skin. Okay, this, make sure this is locked up. And just being cognizant to not touch any of this area here. Okay, all right, are you doing okay, Mrs. Johnson? She says she's doing okay. So then I would take off my gloves and wash my hands, and then I'm gonna just mark on here the date and time of when I put the catheter, IV catheter in. And then I would throw all my supplies away, get rid of all of this stuff, wash my hands again, document the date and time that the catheter was in, and then what gauge needle that I used, and if I had any issues or if I had to stick her more than once, and also if I had or if Mrs. Johnson had any issues or how she reacted to it. I would also make sure I documented that. And I think that's it.